So, here we are. We're nitrogen, and you, as you know obviously, are Allergan. We've prepared this short film for you to demonstrate our understanding of glaucoma and of tears, our knowledge of the treatments that are currently out there, and Allergan's position in these significant areas of ophthalmology. And finally, how we creatively distill our research and set the scene for our market insights into a memorable format without using 85 PowerPoint slides. We want you awake during our pitch. So please sit back and watch while we take you on a brief journey. So, let's start with glaucoma, a very misunderstood disease. The glaucomas are a group of eye disorders characterized by progressive optic nerve damage, at least partly due to increased intraocular pressure, or IOP, of the fluid in the front chamber of the eye. Increased pressure in the eye doesn't sound like much, but worldwide there are over 65 million suspected cases of glaucoma, and more than 12.5 million people are blind as a result of the disease. After cancer and heart disease, blindness is the illness that we fear the most. Glaucoma is the leading cause of blindness in Europe and has an estimated prevalence of 2.3 million in the 5 major European markets. Everyone is at risk of glaucoma at any age, but it's usually seen in the over 40s and is 6 times more common in people over 60. Although the prevalence of glaucoma is approximately 2% year on year, the number of cases of ocular hypertension and suspected glaucoma far exceeds this, affecting 4 to 10% of people over 40. The underlying cause is largely unknown, and the disease is often asymptomatic until vision becomes significantly impaired. Patients are usually diagnosed during a routine eye test or following complaints that they're having difficulty driving or have noticed that their vision is deteriorating. Apart from increasing age, other risk factors for the development of glaucoma include a family history, being short-sighted, and having diabetes. It is 6 to 8 times more common in Afro-Caribbeans than in Caucasians. Open-angle glaucoma, our focus now here today, represents as much as 95% of all cases and can be asymptomatic in the early stages. This type of glaucoma is a result of damage to the optic nerve responsible for carrying images from the eye to the brain. Unidentified, it gradually steals sight without warning. This is because peripheral vision is affected first, which can go unnoticed without regular eye tests. Currently, lowering the IOP is the only clinically proven treatment for glaucoma. The good news is that IOP-lowering medicines, such as those made by Allergan, can slow disease progression, maintain visual field, and improve quality of life. Whilst glaucoma does not shorten life, the disabling loss of vision can greatly affect people's daily activities and independence. Therefore, the goals of treatment are to lower IOP by 20 to 40% and to maintain a patient's visual function and related quality of life. It is generally acknowledged that once IOP gets above 21 millimeters of mercury, there is a likelihood that, without intervention, patients are at risk of long-term visual damage. In the UK, NICE guidance also takes into account corneal thickness, while the European Glaucoma Society recommends that patients with repeated IOP in the high 20s, even without other risk factors, should be considered for treatment. First-line drugs such as prostaglandin analogues or beta blockers are generally given as a single eye drop once or twice a day, depending on the product. More advanced disease may require laser treatment or surgery. All treatment must be individualized to both the needs of each patient and the rate of disease progression, with the aim of using the least amount of medication to achieve the desired therapeutic response, whilst minimizing any associated side effects. The 2 stars of Allergan's current bimatoprost glaucoma franchise are Lumigan and Ganforte. Lumigan is a prostaglandin analogue that works by increasing outflow of fluid from the eye that is used first-line as monotherapy or as an adjunctive therapy with beta blockers. Beta blockers, in contrast, reduce the production of fluid within the eye. Pfizer's prostaglandin analogue Xalatan has been widely considered a gold standard treatment, but goes off patent in 2011. Whilst generic penetration is predicted to cause market decline of nearly 10% in the next 2 years, fixed combinations are predicted to drive the European market, with a UK market share of over 20% predicted for 2014. Ganfort is Allergan's fixed combination prostaglandin analog and beta blocker for use in patients who don't respond sufficiently to monotherapy with either agent. So, how's the future looking for Allergan in glaucoma? Well, Lumigan 0.01%, with its significantly improved tolerability versus the 0.03% solution, has already been launched successfully in most of the big 5 European markets in 2010 and will roll out soon in other countries. The fact that Lumigan 0.01% is less likely to cause hyperemia addresses a key issue in the increasingly crowded glaucoma marketplace. Ganfort offers the superior efficacy of dual therapy for patients who need it, with the added compliance benefit of a fixed combination product. Underpinned by the confidence and reassurance of Allergan's 60 years heritage in glaucoma and its accompanying wealth of data and experience, Allergan's bimatoprost franchise is now uniquely placed to offer its customers the complete solution in glaucoma.